everyone, and welcome to another episode of Ask the Doc. I'm your host, Jennifer Filzen, and today I have with me Stephanie Pearson of PearsonRavitz Insurance. Welcome, Stephanie.
Hi, nice to be here. Thanks for having me.
I'm thrilled that you're here, Pennsylvania. That's awesome. And I know that you're doing insurance, so this is great. I'm thrilled to talk with a fellow insurance person because I used to do insurance way back in the day, and the medical profession certainly needs it. So tell me a little bit about what you're doing over there at your business.
So basically, I am an OBGYN by training. Unfortunately, I suffered an injury while I was delivering one of my patients, and I had a frozen shoulder, torn labrum, had surgery. My surgery did not go as well as planned, and unfortunately, I have not been cleared to do OB or operate, and I learned a lot the hard way about the insurance industry. And after enough people asked me to help them with their policies, I figured the only way for me to do it really ethically was to get licensed. And so it kind of fell in my lap in that I wasn't really sure what I was going to do after medicine. And someone had mentioned that I should look at what I'm passionate about. And I became very passionate about disability insurance because I found out a lot the hard way and was not properly educated for, felt like I wasn't being properly advocated for. And I really wanted to change the way that the industry was handled, especially for physicians.
Bravo. I love it how and I'm so sorry for the injury that you sustained on your job. When you love what you do, and that's literally torn away from you because your body is not cooperating. But look at you now. You are changing things in the world of medicine and insurance by what you're doing. You're that perfect bridge, right? That's helping people. And it's true because I am familiar with life and health and property casualty. I'm not on the doctor side of things, but I do know that everybody gets confused about what to do, even when it's a simple fender bender on their car, because we don't do it frequently enough. We're not doing it every day, and we don't know all the little ins and outs. So are there any amazing success stories that you have to share about the work that you're doing in your business?
Absolutely. When I started doing this, a woman who had a C-section for any reason would end up with a future pregnancy exclusion, meaning that the carriers would not cover future pregnancies because they all viewed C-sections as an abnormal outcome of pregnancy. And especially as an OBGYN, that hit a little bit close to home. I also happened to make breech babies, so super close to home. And I started flooding all of the carriers with medical papers, with ACOG bulletins, the American College of OB/GYN. And I'm happy to say that over the last 5 years, we have gotten 5 of the 6 traditional carriers to now look at why someone's had a C-section. And sometimes we can get future pregnancies covered with a simple exclusion saying complications of future C-sections. So that was a huge feather in our cap. We also, when we started this company, Truvada was an automatic red mark against somebody's policy options. It led to limitations that I felt were not fair. And I can say that all 6 companies now don't look at anything negatively with somebody taking Truvada. And there are a couple other ones that we have. I mean, I'm really proud that we've been able to actually affect change in the underwriting process and help advocate for people based on good medicine. And I'm aware that community medicine and insurance medicine aren't the same, but we really try to make things fair.
I love what you're doing, and bravo. There's one other thing that I'm very curious about, and we're short on time, so we have to make this brief, and I'm opening up a can of worms, but I want to talk about the repeal of Roe v. Wade and how that's changing a lot of lives. How are insurance companies viewing that per state? Are they? It's so confusing what's going on, right? And how are you navigating that as an insurance professional?
From a disability and life insurance standpoint, it's actually not the can of worms you thought it was. It doesn't really do anything for us. I suppose moving forward, if people end up with complications from doing things maybe not above board, it may be a concern. But as of right now, it really hasn't done anything to the DI or LI space.
Okay. Good to know. Good to know. Because again, I'm familiar with it as you are very familiar with it. So my information is really old. So good for you. Well, everybody, we've run out of time, but listen, Stephanie, you've been amazing. Thank you so much for being on Ask the Doc. And everybody, if you want to find out more about the good work they're doing at PearsonRavitz in Pennsylvania, please go to BuzzTV at iwantabuzz.com to find out more information about it. Thank you so much for tuning in, and we'll see you next time. Bye.